Hello, welcome to our little mini series on pleasure. In this video, we're going to talk about sexual pleasure and how that might help your pelvic floor. Hi there, I'm Justine Calderwood. I'm a pelvic floor physical therapist, and we're doing a little mini series here in the month of February and talking about pleasure. And if you are currently suffering from some pelvic floor issues, such as pelvic pain that prevents you maybe from being as intimate, as you'd like to be, and it's affecting your sex life and you don't feel like you're ever going to get there, you might want to catch the first few videos that I made. We talked about starting, because it may seem really overwhelming right now if you're in that situation where you are experiencing some pain or insecurities or other concerns regarding your pelvic floor that's preventing you from being able to have sex, basically, or be sexual. So catch those previous videos. We talked about some ways to kind of move towards that if you are currently experiencing some issues. So today we're going to talk more about more sexual pleasure. So I want to go over just a little bit, because I work primarily with women, me personally, I'm going to really stick to kind of female pleasure and give you some resources and some illustrations. So one thing I want to say is just we really got to be thinking about with the female anatomy that the clitoris is really the erectile tissue and the sexual organ, really. So most people think that, penetrative intercourse, if that's your goal, that, you can just orgasm basically through penetrative intercourse. And for a lot of women, that's simply not true, that they may need a little external stimulation around the clitoral tissue. And I want to show you some anatomy photos so that you have a better understanding, okay? Because I think the patients that I've worked with, this really makes a big difference, not only for them, but when their partners come in, and sometimes we talk about this, and it can really help them be more intimate and feel more empowered in the bedroom, okay? So I'm going to show you this. This is just a side-to-side illustration of what the clitoris looks like in relation to the penis, okay? So you can see here, they very much look very similar, right? And so a lot of people think that the clitoris really is just like this pleasure button here at the top, and that stimulation is only needed there. But coming down here and really touching down into the sides can make a big difference for a lady, okay? So I wanted to show you that. And then another thing, and these illustrations are through Pelvic Guru. I do have a membership with them, so I have access and the rights to these copyrighted illustrations. Okay, so if you look here, hopefully you can see this. It just looks at like opening up the labia here. The clitoral hood here is at the very top. And when we do have, the tissue comes down really, and as it gets engorged, as a woman does feel excited, then this does engorge with blood flow, and it does swell, okay? So I'm going to show you this. From the outside here, we have an aroused vulva. So the vulva really is the outside. The vaginal canal is right here in the middle, and we have the clitoral glands up here at the top. So this hood actually kind of covers the clitoris, and then when a woman gets excited, then that kind of pulls up just a little bit, okay? And then last one here is just comparing resting clitoral tissue compared to aroused tissue, okay? So I wanted to show you that. And interestingly enough, one of my classes recently, somebody that was in the class, she shared with us, she's actually, I think her title is sexologist, and so she shared with us something very interesting that she said, a lot of us physical therapists are helping to help decrease pain with people with pelvic floor pain. And she said, a lot of times the focus is on decreasing the pain and getting rid of the pain. But if you actually focus, the opposite of pain is pleasure. So for a lot of people, if we can focus on pleasure and increasing that, can actually naturally decrease pelvic pain. So this is what I wanted the point of this video to be more about, is how can we move into that sexual pleasure a little bit at a time as well. So I just have my female model here, the pelvis. So if I tip this back, this would be like if a lady was lying on her back. So you can see here, I have to keep this in place, but We have the vaginal opening here, we have the rectum down here, we have the urethra at the top, and then the clitoris up a little bit higher, okay? So you can see pelvic floor muscles in through here. So this clitoral tissue really is at the top, it comes down along the labia, okay? So keep that in mind. So, you know, these tips can really be used. You can do them, by yourself. I really encourage you, explore your own pelvic area. Know what feels good to you so that when you maybe want to, be with a partner, then you know your own body, okay? So this can be done with a partner, exploring, but it can also be done by yourself. And I know from my patients, sometimes we talk about there can be a lot of shame and thoughts and beliefs around the ability to say touch ourselves. And so for some people there might be a lot of resistance to this idea of what I'm going to share with you, and that's okay. You can sit with that. You can see, is that still true for you? And it's totally up to you. You don't have to do anything that I suggest to you, okay? However, if you are interested in this, keep listening. I have another little silicone model here. So I recommend, if you're gonna kind of explore the genital area and looking more for that sexual pleasure, start with making yourself feel comfortable. Talking about that first video we talked about, maybe put on some soft music. Maybe for you it's about breath work and relaxing into your body after a long day. It can be lighting a candle or just setting the mood in a way, making yourself feel comfortable. So then from there, you might even just start with some, gentle massage into your shoulders, some neck roll or like shoulder rolls. Maybe you want to, touch down into the breast tissue, down into the lower abdomen, that type of thing. Okay. Then what you can do, you can explore just this, sexual tissue basically. So I recommend get a little bit of a lubricant, and organic coconut oil is a good choice. If you do have say issues with UTIs, I wouldn't recommend this just because it can be a little bit of a higher sugar content, so that can contribute some to that. But organic olive oil, you can pick different types of lubricant. We like this silicone lubricant as well, Uber Lube. We have samples of that here in the office that we give to our patients as well. So I just recommend, start with just very gently kind of feeling into this tissue, and you can use a finger along the inside, but really explore what does it feel like along the top versus kind of coming down into the labia and even down into that vaginal entrance. So one finger, two finger, whatever feels good to you. See what your body needs and what feels good to you. That way, again, you know what you need, say for orgasm and feeling good in your body, and so that you can kind of guide a partner as well. So, all right, that's all I wanted to share with you today. If you have any questions, please reach out. If you are experiencing some pelvic floor issues that you want a little bit of advice about, you want to talk to a professional, please reach out to us. You can go to our website, healingspotpt.com. We have some forms on our homepage. Fill one of those forms out. It's completely confidential. We're not going to share your information with other people, and we'd be happy to help you out in this area. So thank you so much for listening, and hope you have a wonderful day.